This video is to give instructions on how to use the Stryker drainage system. Obtain a Paul filter for the blood administration. They come in the small packages as you see here. If you're ever uncertain about the positioning, there's instructions in the packaging right here that shows how to position the Paul filter. Upon entering the room, Abby is my assistant here that is going to let the patient know what we're doing, and then we'll go from there.
All right, Mike, first of all, we're just going to flush your IV just to make sure that your IV is working good. All right, and that flush is fine. So now I'm going to connect the blood tubing to your hand.
And our blood tubing consists of a bag of 500 milliliters of normal saline using white tubing and the Paul filter that I showed you earlier, and she'll be connecting that.
All right.
Here's your Paul filter, Abby.
Let me get him flushing here first. So your IV flushed good, so I'm just going to go ahead and run the normal saline until we get your blood tubing up and going. Alright, and then this is the Paul filter. It's going to go on the second Y of the blood tubing. The long portion is going to go into the actual blood bag itself from the Stryker. And the Paul filter pushes fairly hard onto the tubing, so you just kind of got to twist it on there. Alright, so we have that ready to go. Alrighty, so we have our blood tubing up and running. It's ready to go. Next of all, just gonna open the Stryker drainage bag. And we're gonna clamp it off to the patient. All right.
There's a couple buttons on the top of the Stryker. One is the red button. It's a suctioning device. It should be depressed, and the Stryker should be set on either 2 or 3. Normally it's set on 2. So she's getting ready now to actually put the blood into the bag. So to do that, she's going to press the blue button, hold the tubing slightly upward until it starts flowing in, and then downward. And as you see, the blood is going down into the bag. Now we don't want the bag to sit on the floor. But as you can see, the blood's draining into the bag and from the Stryker. There's also a sticker on the side of the Stryker pump here that has the patient's name and the time that it was originally started. As you can see, it was at 12:30. So 4 hours from that time is when we will process, and that's what we're doing now, is processing. As the blood goes all the way into the bag, we'll clamp it down close to the bag. Clamp at the bottom of the pump and then next to the bag as the blood all gets down into the bag. Those pump clamps are very hard to clamp close, but they do stay on once you clamp them on. We rush all the blood down into that bag that's in your line. Now these bags are used for the additional bag, if needed, of blood to transfuse in 4 hours. We can transfuse 3 bags of blood within a 12-hour period, and after that the Stryker goes strictly to a drain. So as you can see, she's clamping that closed, and that prevents the blood from going back down into the line. If she turns it upside down there, it doesn't flow back down, and we just hang it up and attach it to the Y tubing.
Make sure that you always pull the Y, the white, the longer one of the two on the Stryker bags. So both of my blood tubing clamps are clamped.
And prior to starting the blood, you will do your blood vitals as you would any other time when you're transfusing blood. You'll remain in the room for 15 minutes to monitor the blood product and the patient's vitals and how his reaction is to the blood. Squeeze on the chamber and the blood starts dripping in. Now we start the time of transfusion when the blood actually is down to the patient's wrist. As you can see, his tubing is going here and the blood is not there yet. So we'll actually start the time when it's down at his hand. And so Abby's just doing that right now, letting the blood go down to his hand. Now you're going to monitor the site where the blood's going in, the IV site here. Make sure that there's no swelling, no redness, that everything's going in fine. And we're going to check with our patient and make sure that his vital signs are staying stable and that he's not having any reaction, no dizziness, no lightheadedness, no change in vital signs. This is what you should look like up here, your Y tubing in your bag. Now the canister, the actual Stryker canister, if you notice here, has about 75 cc's of blood still in that bag or in that canister. That will stay in there. That will remain there the whole time. So you always allow that to remain in there. It will not flow out. So when you start your count for how much blood is going in there, start it at 75. And then you're going to put a new sticker over the old one with the time that we did this blood, which will be 16:30 on this one. And then in 4 hours, we'll do this process again.